Well, the East African Development Bank is 51 years old this year, and given that long track record, we have made significant interventions in the health sector. We have built hospitals in all our member countries. We also support private sector in putting up health facilities like private clinics within the region. Recently, in the course of our other work, it's become apparent to us, even as bankers, that we have a silent epidemic that is affecting the population in East Africa, both urban and rural. This epidemic is cancer. So we decided that as part of our contribution to the community, we set up a program that would help doctors, particularly those that are based in rural areas, in rural hospitals, in districts and in other far-flung places away from the capital, to be able to attend to patients that come to them and to be able to identify cancer or its symptoms early.
One of the important things about oncology is to demystify that it is an incurable disease.
As we live today in an era where cancer is on the rise, we are of course seeing a transition of disease from infection-related diseases to the non-communicable diseases, of which actually cancer is on the rise. Longevity has its place in our community now. We are living longer, and many of us are actually going to be victims or patients of cancer in a matter of time. And therefore, I think this course and this training is preparing the health force in our country to get ready for this epidemiological transition.
Omoding knows about this gentleman. He's a senior consultant gynecologist. He walks to me and he says, my lower limbs are swelling. So I said, well, get an ultrasound scan of the iliac region and then you come back to me. So when I saw those lymph nodes, I told him, you know what, this is CA prostate. And actually it turned out to be CA prostate. We did PSA that day, 40. I said, this is CA prostate. So he was able to get to Cancer Institute. He got the help we needed. He's on chemotherapy and he's doing great.
This is the second year. Each year you get a group and each group is unique. The region is small, East African region. And now you're going to have the East Central South African College of Physicians, which is even going to unite us more. So you never know. We may be the trainers of neurology in Exacop, you never know. And some of you may be trainers. I see some of you here look like trainers, physically, but even mentally.
We feel really honored to attend this course. And we have very limited doctors and scarce neurologists in our country. So this course has helped us a lot with gaining these skills, especially the history, the examination, and what we have learned through the case-based learning, that we can find easily what we can do with these people.
This course has been quite the learning experience for all of us, and I'd really want to appreciate the faculty, because there's a lot of cases also we don't get to experience as much, but when we get them, they really leave you stumped. I think it's the most neurology, I'd say, learning experience that we've had through the whole entire time.
My name is Reverend Karon Peter Karanja, the General Secretary of NCCK. EADB was the first partner to resonate thoroughly with our vision and desire to make healthcare available, to enhance accessibility, improve outcomes by a higher standard of investment, and be conscious of cost to make it as affordable to Kenyans as possible. And we are deeply grateful for this.